If we asked you to think of some psychopaths, some of the first names that might come up to mind are some notable serial killers, such as Ted Bundy or Jeffrey Dahmer. While most people think that psychopathy is a rare condition, experts actually estimate that about 1% of the world's population exhibit psychopathic behavior. That means that out of the 8.1 billion people on this planet, roughly 81 million people exhibit these behaviors. In fact, based on these statistics, there's a good chance that someone in this very room might be a psychopath. Unfortunately, despite their prevalence, psychopaths are often ostracized and isolated in society. With this many people who demonstrate these psychopathic behaviors, it begs the question, what are the barriers to helping psychopaths acquire pro-social skills? Hi, my name is Sophia Xiao.
Hi, I'm Melissa Adams.
Hi, I'm Tanvi Dukirala.
Hello, I'm Sophia Sharp.
I'm Audrey Sloop.
I'm Zuri Johnson.
And I'm Kelly Lee.
And we are so excited to be bringing you our research question. What are the barriers to helping psychopaths acquire pro-social skills?
All right, so let's start with what exactly is a psychopath and what traits do they give off? So psychopathy is a mental condition that is characterized by the following traits. Mostly, you'll be able to see almost immediately that they have a general lack of empathy for others. They also may distribute manipulative behavior. They might say cruel things to you and feel no guilt about it at all. They also have deficient emotional responses, and they'll definitely show aggressive tendencies, especially as a child. Now let's talk about the neurological differences in the brain. Studies show that they have about a 10% larger striatum, which is the part of the brain responsible for motor and action planning, decision-making, motivation, reinforcement, and reward perception. Now let's talk about treatments. There actually is no official treatment for psychopathy. There's no pill, there's no vaccine, and there's no device that can instill empathy into these individuals. Many psychopaths actually go untreated and undiagnosed. Many people want to treat psychopaths by locking them up, putting them in solitary or even in prison because they believe that they're dangerous murderers. But actually, that actually leads into our next topic, which is the struggles of being a psychopath. Because of people's preconceived notions that are usually incorrect, psychopaths lead a lonely life and they often feel alone. So that makes them more susceptible to drug and alcohol abuse. Because when they're left alone, you've been left alone before, that you get in your own head and you think dark thoughts. And so that leaves them to turn to drug and alcohol, and that makes their aggressive behavior worse. It's also difficult for them to form relationships because they don't feel emotions like we do. And they're also more susceptible to anxiety, depression, and other mental disorders.
So how can we do better? First, we need to look at some methods that are already available. One example of this is schema therapy. This targets deficits and treats them by using methods such as role playing and journaling emotions to target those deficits and work to improve them. But this one is typically targeted towards adults. For kids, however, we've created sort of our own methods that are more strength-based, redirective therapeutic exercises.
Okay, so let's talk about key issues. So instead of trying to treat and prevent psychopathy, we aim to utilize its strengths to benefit society. We are attempting to use our knowledge to look at a new perspective on psychopaths. Another issue is how psychopaths are depicted in the media and is often not how they actually are. Society has viewed psychopaths to be vicious killers, which isn't always the case. Many psychopaths are known to be narcissistic, which is when they think they're above everybody and show off confidence and pridefulness, which in society is known to be good characteristics. But think about who it involves. If you had a narcissistic psychopath as a social media influencer, tell me, would you want to be influenced by them? Something else to think about is a lot of violence is oriented to narcissism. So if you are narcissistic, you tend to isolate yourself because you want to be around people who are as good as you, but you never find them. So when you start to isolate yourself, you start having aggression, no outlet to take out that aggression. So then you turn to violence. And these people aren't someone you want to be around.
Regarding the ethical, legal, and social implications of why our idea should be done, there are a few things to consider. One question may be why? Well, by redirecting psychopathic behaviors to positive implications in society, we can prevent them from using violence as an outlet. It's simply a matter of numbers. By aiming to help the 1% of the world who may be psychopaths, we can help so many more in the avoidance of violence. This brings another concern about whether or not we're dehumanizing them. It has been shown that psychopaths actually have immense pain, sadness, and loneliness. Oftentimes, whenever they act upon their violent thoughts, it's because they felt like they've disconnected from the world. So by immersing them in the society, we can prevent these violence acts from being committed. Whether or not cognitive behavioral therapy is humane and effective is another concern. We plan on using schema therapy, which aims to create deep and genuine connections to change these unhealthy coping mechanisms. In fact, studies have shown that this is both effective and humane, with psychopaths having a 22% reduction in violence when treated with this.
Is this therapy really ethical? First of all, is it affordable? Most insurances do not cover it. So how can we make it more accessible to all of society? Well, we can try and lower the costs. Also, who has access to this information? What are the limits between the therapist and client's confidentiality? Do the police force have access to it? Police are allowed to access these documents without informing the patient of it. Do all psychopaths pose a threat to society? Is it fair to judge someone based on their genetic markers? Psychopaths are known to be lonely, which increases this condition. Many people tend to stay away from them because they think they'll be targeted by them.
So our proposal to help, our proposal for our redirected therapy is to detect these psychopathic behaviors at a young age, such as callous behavior or putting others at risk, like in harm's way, and then to redirect that behavior by giving them an outlet for that heightened energy and those emotions. These could be things such as like writing what you're feeling or punching like a pillow, just anything that isn't harmful directly towards their peers. After this, well, first off, you would have to give them a choice. You could give them two options as to how they can redirect their emotions so that they feel like they're in charge, and then you would reward them for doing so. They have to feel like they're getting something out of it, which they are, in order to start forming those habits and automatically turn to those redirections in the future.
So let's talk about limitations. So this method is not guaranteed to be 100% effective, nor is it going to solve every solution to a patient's problem. Willingness. These patients may not be receptive to this. Okay. These patients may be unwilling to perform certain tasks, which could lead to morals, which means they may not be able to, they may not believe certain forms of medicine, or they may not believe in certain forms of therapy. Lastly, access. Not every patient has access, whether that may be financially, whether they are tight on money or can't afford it, or if they have lack of access for transportation.
So, as we mentioned before, psychopaths are characterized by a lack of empathy and manipulative behavior. Rather than just using schema therapy later in life to detect these deficiencies, Using strength-based therapy during the early development of psychotic behaviors in children could possibly lead to the redirection of antisocial behavior into prosocial behavior, which could eventually be utilized and strengthened in the future professions. Just remember, the ultimate goal of our idea is not to prevent psychopathy, but rather to help those and humanize those 81 million labeled psychopaths. Thank you.